to Docs on Call, brought to you by Northeast OBGYN, with your host, Liz Schatzline.
Good evening, I'm Liz Schatzline, and welcome to our new program, Docs on Call, the show where you can ask the questions. Our topic tonight? Every year, more than 600,000 women get the news that they need a hysterectomy, the removal of the uterus. Many of those women will have the traditional surgery. That includes a large incision and some pretty significant recovery time. But there is another option. It's called the DaVinci Surgical System, and it involves a surgeon with a little assist from a robot. Tonight, I'm very happy to welcome to our program Dr. Geoffrey Cly. He is a physician with Northeast OBGYN, and he is going to explain to us what the DaVinci system is, and will answer your phone calls as well. Dr. Cly, thank you so much for being here.
Thank you very much for having me.
Now, I know most people have absolutely no familiarity with the DaVinci system, so why don't you start by telling us exactly what it is?
This is a wonderful system that's causing a revolution in healthcare today. Much like happened in the early 90s, where a lot of large surgical incision procedures went to the laparoscopic procedures like an appendix surgery or gallbladder surgery. Well, this has taken it the next step in eliminating those large incisions for men and women. And in my case, as a gynecologist, it's allowed me to use this system to allow women to go home in a couple of hours and back to normal in a few days to a week from a hysterectomy. And it uses technology, a computer, robotic arms that I control to take my hands from the normal size down to 5 millimeters. So I'm able to work through these small incisions at a 5 millimeter level to do the surgery. And so the patient only has very small incisions when she wakes up.
So this is very intricate work, right? Much more so than you could do with a normal incision.
Absolutely. And as we see in a few minutes, the robotic hands, they move just like the human wrist does, which is something we've never had before. So that's the revolution, is now we can feel like we're inside the patient on a 5 millimeter, half a centimeter level doing the surgery. And the patients recover so much faster.
Okay, now you have some video that we're going to show right now of the DaVinci system and exactly how it works. How long has this technology been around, Dr. Cly?
It's been out for less than 10 years. It originally started with the military, and then the physicians figured out some ways to use it. And what we're looking at here is the surgeon or myself over on the console. The system is over the patient who's laying on the table. We're in the same room, and I'm controlling those instruments through a three-dimensional high-resolution video camera. And I can move the camera and move the instruments, and so I can perform the complete operation through just inside the room through those teeny-weeny instruments that you're seeing there. And at the tip of those, that was 2 millimeters.
That is small.
Very small.
Now, what is this?
We're looking at the 3D high-resolution image. So it's kind of a virtual reality system. So as I'm looking through, I feel like I'm actually inside the patient. And you'll see the hands move there. And then on the inside, exactly what my fingers do, those instruments do. And there's a double image there.
Is this disconcerting for you, trying to do this? I mean, how hard was this to learn?
It's actually, the company's called Intuitive, and it's very intuitive. At one of the hospitals in town, we've had the system out in the lobby, and we've had 4-year-olds get on and do procedures with little rubber bands, and it's very easy to do.
Really?
Don't tell many of the doctors that.
Okay. Dr. Cly, by the way, is going to take your calls tonight. If you have questions concerning the DaVinci system and hysterectomy, you may call 483-8331, 483-8331. We will be happy to answer your calls tonight. Now, Dr. Cly, who is a candidate for this kind of surgery?
For almost everybody is a candidate. Right now, we use it primarily on patients who have to have the large incision. And so if I try to tell patients to tell their families and loved ones that if a doctor's saying you've got to have this big incision for your hysterectomy, then that person's not yet trained on the DaVinci system. And just to ask the question, I want the new alternative so that I don't have to be off work for 6 weeks. I can drive the next day, I can go back to normal in 3 to 7 days, and I can go home the same day.
Okay, so age is not a factor, weight is not a factor, everyone is eligible.
Everyone is eligible, and actually the more complex the patient's situation, the better they do on the DaVinci. A simple hysterectomy can still be done the vaginal route. You can do that with the daVinci as well, but a complex hysterectomy, a large uterus, a heavy patient, a lot of scar tissue, difficult anatomy, those are perfect for the daVinci system.
What are the reasons you do a hysterectomy? We mentioned 600,000 a year. That's a lot of hysterectomies. Why?
Usually it's a combination of pain, bleeding, maybe some fibroid growths, which are fibroid tumors are very common. And those are the main reasons. We try to not do the hysterectomy starting out. We try to do non-surgical options. But eventually, sometimes we get down the path where the only option left is a hysterectomy. And a lot of women have suffered for so long and may be bleeding for 14 days each month and cramping and missing work and missing time with their family. And that's kind of the situation where if we take out the uterus, they won't have any more bleeding or cramping. They'll have that time back with their life and their family. That's separate from the ovaries. A lot of people think hysterectomy equals ovaries. We usually try to leave the ovaries. We've learned not to take the ovaries out. A woman needs her ovaries as long as she can.
Why is that?
They provide the hormones to make the woman feel normal. If we take out the ovaries, she feels like she's in menopause, hot flashes, night sweats, irritability. If we leave those ovaries, take out the uterus, she'll still feel like herself, but won't have any more periods.
Okay. You know, as someone who watched my mother go through a hysterectomy 35 years ago, and it was quite an ordeal, it's really something to try to get your mind around the fact that a hysterectomy can be an outpatient procedure.
It is. It's fantastic. I had a patient just a couple weeks ago, came in the second day after the hysterectomy. She went home in 3 hours, and she came in complaining of pain, and I said, well, what's going on? She said, I just mowed the grass today, and I did a little too much. And it's just phenomenal how well people do. And we're finding that patients can go home in around 3 hours. We have some other little pain tricks to try to prevent the pain from starting. Many patients are starting with Motrin is what they're taking when they go home, driving the next day and walking around. It's phenomenal to see, and the friends and family are usually amazed.
That is truly incredible. We have a caller waiting, Dr. Cly. Karen is on the phone. Good evening, Karen. You have a question for Dr. Cly.
Hello?
Yes, I do.
Go ahead.
Okay, I just had surgery done, and he went in and tightened my muscles up, and then I had another doctor put sling in, and I'm still having difficulties, and they wouldn't do a hysterectomy. What do you recommend I do?
It sounds like if you need the hysterectomy for reasons of pain, bleeding, cramping, then I would definitely talk with your doctor about that. It sounds like they did something a little bit different, maybe for a procedure. I'm reading into what you were saying for prolapse. But I would go back to the doctor and ask him about the hysterectomy and see if you have reasons for that, or if there's other ways to treat those symptoms.
Now, she brings up an interesting point, prolapse. Can you use the daVinci system for other procedures besides hysterectomy?
Absolutely. It's great for myomectomy or removing fibroids, usually in a patient who wants to get pregnant, but the fibroids are preventing that from happening. It's also very good for certain types of pelvic or vaginal prolapse. And we can do it with the daVinci without making that large incision again. There's still certain prolapses that need to be done the vaginal route, but this works very well for some of the upper vaginal prolapses.
Are fibroids dangerous, Dr. Cly?
Not dangerous themselves, but if they grow to such a size where they would cause a woman to bleed to the point of needing a blood transfusion, that can become dangerous. And many women come in the early stages when they start causing issues with quality of life, heavy bleeding. I had a few women who wait longer, and then it gets to be the size of a 2, 3, 4, or 5 month pregnancy. Those are a little tougher to deal with, but up until about a 5-month pregnancy size, the daVinci can do those hysterectomies as well.
Even that big? Because I had a friend who actually had fibroids that were big enough that she was carrying, they said 3-month pregnancy is where she was at, and I thought, why don't you go in and have those out? But a lot of women don't, because they just don't want to go through the surgery. Right,
and this is changing, revolutionizing healthcare, and it's doing the same thing on the men's side. This is what they use for prostate cancer, and they're using it for heart bypass grafts as well.
That's right, it's all across the board now. What about insurance, Dr. Cly? Is this covered by insurance?
It's absolutely covered, the same as it is right now for regular hysterectomies. And the charge is the same, the bill is the same. I make the same money as a regular hysterectomy. So they've kind of taken out the incentive. So there's not a financial incentive for me to try to do this more than something else, which I think is good. We want to keep it honest and make sure that we're doing the right thing for the patients. For the patients, though, I tell my patients, you're going to feel good in 3 to 7 days. employers and insurance right now give them 6 weeks off. So I have some patients who are taking their full 6 weeks because they've been saving for years, and they're going on vacation. And one woman said for her it was wonderful because she was able to finally get up and make breakfast for her kids every morning and get them off to school, and that for her was the best part of the whole thing.
Oh, well, that's nice. We have another caller standing by. Robin is on the line. Good evening. You have a question for Dr. Cly.
Yes,
Hello?
I do.
Go right ahead.
Okay, I had a hysterectomy in 1994, and I had my uterus removed, and right now I am going through hot flashes. I still have my ovaries and my fallopian tubes, and I wanted to know, why am I going through perimenopause and I still have my ovaries?
Thank you for the question, Robin. The ovaries usually continue to function and give a woman hormones until around age 50, plus or minus a few years. So a lot of it depends on when your mother went through the change and kind of what's going on in your life. But I would talk to your doctor about that and see if there's something they can do, whether you want to be on hormones or natural hormones or just alternative vitamin therapy. There's multiple things that can help you feel better.
So even though you've had your uterus removed, if you still have your ovaries, you're going to go through menopause, right?
At some point, yes.
That's okay. We have another caller waiting, Barbara. Barbara is on the line. Good evening. You have a question for Dr. Cly?
Hello?
Hi, Barbara. Are you there?
Yes.
Yes,
I'm
go
here.
right ahead. We can hear you.
I just wanted to thank that. Yes, I'm here.
Yes, go ahead.
I wanted to thank Dr. Cly.
Thank you.
Was a referral, did a full hysterectomy on me, and ended up taking care of me afterwards. I picked up a MRSA infection at the hospital, which was in Indianapolis. And he just did a tremendous job and sticking with me, and it's just been great. I'm doing fine right now, as far as I know.
Yeah, thank you, Barbara. I remember, I hear that voice. I remember you fondly. You're a wonderful lady, and I believe the surgery was right before the daVinci technology came to town, and I'm glad you're doing well. I'd love to see you again. We had some great conversations in the office.
Well, it's nice to have a good testimonial like that. And she brings up an interesting point. Infection rates, are they lower with the daVinci?
Yes, definitely lower. The incisions are dime size, so that's one reason they're lower. There's very little bleeding and blood loss, and another reason they're lower. And we usually lose just a couple teaspoons of blood with this procedure compared to the regular hysterectomy, which is about a pop can full. So if a patient keeps their own blood, she feels better, she's less susceptible to infections. And then with the smaller incisions, it's less likely to get bacteria through that skin incision.
The smaller incision you can make, the better off the patient is. We have another caller waiting. Laura, are you there? We can hear you. Go ahead with your question.
Yeah, I'm 26 years old. I'm mom. I've had 3 children. My tubes are tied. Is it a good thing to get a hysterectomy?
Okay.
That's a good question. It depends on what the reason is. You are young. If you have issues that are affecting your quality of life that we can't resolve with other methods, or the best way to make your life better, to feel better, especially raising your kids, and a hysterectomy is the reason, then it might be appropriate. But if you're 26, I would absolutely recommend keeping your ovaries, so that if you did need the hysterectomy, you're not going to feel like you're in menopause.
If someone does have her ovaries removed, will she immediately go into menopause? Is that it, no matter what age?
No matter what age. Once those ovaries are out, the menopause begins the next day. Usually a younger woman, I would recommend trying to help them feel normal and taking some type of hormone replacement or alternative therapy, either vitamin therapy or natural herbs, to help them have that quality of life and protect their bones, protect their heart, and some other medical issues so that they have a long, long natural life.
Okay, you mentioned fibroids and removal of fibroids for fertility. How does the daVinci system impact fertility?
It improves, in that case, it improves fertility. I have a patient right now who had a large amount of fibroids, 20 fibroids in her uterus.
Whoa.
And absolutely unable to get pregnant. Had the daVinci done, had those fibroids removed, is now pregnant, halfway through her pregnancy. It's a beautiful story, and I can't wait to help her deliver that baby. The fibroids are regrowing, during the pregnancy. And we'll look at the issue again, whether she wants to have more kids, but just to have this one option and possibility, she and her husband are overjoyed.
I can imagine. We have another caller standing by. Joshua is on the phone. Good evening. You are on the air. Hi, go ahead. Joshua, are you there?
Yeah, I'm sorry. My wife has had painful menstruation her whole entire life, and every doctor she's ever been to has told her that it's just something she's going to have to deal with. Also, she was on the Nuva ring, I think it's called, and she wasn't supposed to menstruate with it in, but she was. Is there something wrong? Should we look further into it, or just say what the doctors have said, and that's the end of it? She's going to have to deal with it.
I hate to hear that, Joshua, and I'm sorry that she's been told that. I've heard that before, doctors saying you just have to live with the pain. I absolutely would not accept that answer. I think we have so much technology, so much knowledge now that I would seek out further care to try and help her, because she should be able to find a place where she's not going to have severe painful periods and where she'll be able to function. And just got to find a doc who's willing to look. Sometimes it takes time and energy. That's one of the things I like to do. If I got a patient who comes in and they're giving up hope, first thing we talk about is let's get the hope back and let's fix this to the best ability possible.
Okay, thank you. We have another caller waiting. Connie, you are on the air. Go ahead. You have a question for Dr. Cly tonight.
Hello?
Yes.
Hi, go ahead, Connie.
Hi. Yes, I was diagnosed with congestive heart failure and stage 3 kidney disease. And the doctor said I have a really weak heart, but my periods have been like for 2 weeks out of the month, and ever since I started them, they've been really, really painful. And he said my heart's only working like at 23%. Would this procedure, since I can't handle like the regular surgery because of my heart, would this procedure be better?
Oh, good question.
Well, I would recommend talking with your doctor about that. I actually have a patient right now I'm working with a cardiologist on. Sounds like a similar situation, that we're trying to maximize her heart, get her through the surgery, because she's losing so much blood month to month that's also taking a toll on her heart. So I would talk with your cardiologist and your gynecologist about this procedure, or even maybe another procedure. There are some office procedures that would help with your bleeding and cramps that you could try first with less risk to your heart during those procedures.
But overall, the daVinci system is far less stressful for patients, is it not, physically?
Correct. Surgery times are down to less than an hour now.
Wow.
And the bleeding is very minimal, so it's still general anesthesia, but it's not any longer, and we don't lose as much blood, so the patients wake up, they do a lot better physiologically.
Okay, we have another caller waiting. Diane is on the phone. Good evening. Go ahead. You have a question for Dr. Cly.
Hi, this is Diane.
Hi.
Hello.
I had a complete hysterectomy on June 29th, which they removed everything, but I'm still experiencing night sweats, and I don't understand why that would be occurring.
Sure. I don't know if they gave you or talked to you about hormone replacement therapy, or, as I mentioned, the natural alternatives to the hormone replacement, the vitamins or herbs. But if they took everything out, that usually means the ovaries as well. And so that you're going to have those symptoms unless you try some of the natural hormones or herbs and vitamins. There's many prescription hormones that are made from yams and soybeans now. So there's a lot of options out there. Definitely tell your doctor that, and I think they'll help you feel a lot better.
Women do suffer with a lot of things like this, and there's really no need to, right? You can do things to help these women.
Absolutely, absolutely. I kind of teach doctors all over the state of Indiana on the daVinci. I've also done some lecturing on some other issues and hormone issues, and there's so many things we can do, and we have resources now to help a woman feel normal again, to not have those challenges with fatigue, with night sweats, hot flashes, which may be causing marital problems, may be causing job problems, and we can make a big difference nowadays.
Women do not have to suffer in silence.
No way.
We have another caller waiting. Jean, good evening. You are on the air. Go ahead with your question.
Yes, I have a question. What is the normal age of the menopause, to start a menopause? And I have a second question that would possibly be, I was told, I'm 47 years old, and I was told that I might have fibroids, and I was just wondering if the DNC might take care of that first before having to go through the rest of the procedures.
Okay, good questions.
Yeah, it's a great question. 50 plus or minus a few years for menopause. As far as fibroids in a DNC, it'll help the bleeding temporarily, but it won't help long term because the fibroids are still there. One thing I recommend patients do is talk to your friends, family, talk to your doctor. Make sure that all the options are on the table for you as a patient. Maybe her doctor hasn't done the daVinci yet, or maybe doesn't have all the opportunities available to them or all the resources. And that changes a lot of how the patients do and what the doctors are offering. Right now, I'm the only one who's really actively doing the daVinci here in town. I've done about 100 of them. I'm reaching out across all party lines to try and help train other doctors. It takes some time and energy, and there's some traveling involved. But once the patients, they thank you the next day, they come in, they feel good, they wake up, it's well worth it. I go over Indiana and I train doctors, and doctors are a little nervous at first because of this new technology, but once they actually try it, it's very intuitive and very easy for a doctor to now learn. And I kind of think that's one of the things we should do as doctors, because we went into medicine to help people. So we've got to keep learning, we've got to keep changing to help our patients, and it's really worth it.
One interesting fact about the daVinci system, I read you said that as steady as a human hand is, the daVinci system absolutely does not waver. No tremors in the daVinci, right?
Right. It eliminates all tremors and all shakes.
Okay.
So even if I've had too much Starbucks that day, I'm good.
No slipping.
Yep.
Okay, we have another caller standing by. Terry is on the line. Good evening, Terry. You have a question for Dr. Cly.
Yes, I do. And actually, listening to you, you've helped a little bit with some of these other questions. I am actually 51 years old, and I've already had ultrasounds, and they know I have fibrous tumors and these things. I actually have an appointment this coming Monday, and I'm in with the Northeastern OB-GYN. And she has not mentioned the daVinci code, or daVinci procedure, because we've thought about doing the DNC first, because I don't want to be off work that long. So, and then I heard you just say you're the only one that does it. Are there other doctors that will do this? Is there something I can talk to her about this to say, hey, I'm interested in this because it would be a good thing for me?
Absolutely, absolutely. So I would suspect that. I've trained most of my partners in Northeast to do the daVinci. They're still in the early adoption phase, but I would suggest that, or think that maybe she doesn't think the daVinci is necessary yet. Because like I said earlier, we try to do smaller things if we can, and if that works for you, to get your symptoms under control and have a normal quality of life. Because even though the daVinci works great, anytime we put a patient to sleep, anytime you're in the hospital, there are risk, infections, hospital infections, just unusual things happen. So she might be trying to minimize your risk and try to do something to get you back to work right away. And maybe, hopefully, it's not a temporary thing, but sometimes that could be a temporary thing. And I have women who say, I can't take time off. I can only have half a day. Let's just fix the bleeding for now. Next year or in the wintertime, I'll have more time to do a couple days or a week off work.
Okay, all right. We have another caller standing by. Anne, good evening. You're on the air. Go ahead with your question.
Hello?
Hi, Anne. Are you there?
Yes.
Yes, go right ahead.
I was wondering, how is the uterus removed through such a small incision?
That's a good question.
Great question. And actually, we can take the uterus out through the vagina if it's small enough. But there's also another type of a tool we use that takes apple cores out of the uterus until it's completely removed out of a tube that's 1 centimeter. So it's the technology again has allowed us to do something that we never could do before.
So you don't take it out in one fell swoop, it comes out in pieces then.
Exactly, just like taking apple cores out of an apple until the complete apple is gone.
Okay, all right. We have one more caller standing by. Good evening, you're on the air. Go ahead.
Hello?
Hello?
Hi, go ahead. You're on the air.
Hi, sorry. I got a question. My daughter has polycystic ovary disease, and I read an article on where they drill the ovaries. Does anyone do that in town?
Yeah, say it again, where they did the what to the ovaries?
Drilling. It was an article I was reading where they drill.
Yep, ovarian drilling. It's kind of an older technology that we did, much more common 20, 25, 30 years ago. We didn't have a lot of resources at that time to help. So somebody had the idea of drilling the ovary, removing some of the ovarian tissue to decrease some of the hormone output from that tissue. I would recommend trying some other possibilities before you do that ovarian drilling, because you cannot get that tissue back once you drill the ovary.
Okay, so explore other possibilities first. Okay, we have another caller standing by. Sarah, good evening. You're on the air. Go right ahead.
Yes, I just had a question. In regards to, I've been diagnosed with polycystic ovarian syndrome, and they say I'm too young to have a hysterectomy to kind of curb some of the pain that I have. And I was wondering if the daVinci would be a possibility for it.
It sounds like to me that for the polycystic ovarian syndrome and your pain are two separate issues. PCO does not cause pain, it causes irregular bleeding and irregular periods. The pain, I have a feeling I have an idea what it's caused from. It's probably the bladder area right above the vagina. If you have cramping that's painful, then that's a uterine issue, but it's not happening all month. So I would don't look at the hysterectomy as your option here, because I don't think that's going to get you what you're looking for. And I see that unfortunately a lot of times where a woman has pain, the doctor does a hysterectomy, takes out her ovaries, and now she still has pain, and now she doesn't have any hormones because it was actually the bladder, chronic condition right on top of that vagina, and everybody thought it was the uterus. So keep looking a little bit. I deal a lot in that, in the chronic pelvic pain, and I'm happy to take a look, and if we can help make you feel better, we make a big difference dramatically, because we're just trying to think outside the box and really trying to look at the whole possibility. It may not be the easiest solution, because a hysterectomy, in some women's mind, they just want it out. But I want to get you the best solution.
That's right, because once it's out, it can't go back in.
Right.
So you want to make sure that you're doing the right thing. If someone is interested in having the daVinci surgery, as you said, it isn't all that common yet. What should they do?
Get online and just Google daVinci. The website, intuitive website, our website has information. And you can find doctors in your area. You can find doctors listed who are trained to do that surgery. And ask your doctor, say, do you do the daVinci? And if your doctor doesn't, have them call me. I'm willing to train them. I'm in the process of training a couple doctors in the other group right now. And people are eager. Once they sit down and try the machine and their patients are saying, I want that surgery, they're getting it done.
Okay, Dr. Geoffrey Cly, thank you so much for joining us tonight. An interesting show. And thank you for being here. We hope that you will join us again next week for Docs on Call. Our guests will be Dr. David Bodrab and Dr. Stephen Hatch. They are going to be talking about pain management. If you know someone with intractable pain, whether it's back pain, even pain from cancer, they're going to talk about the infusion pump and how it can alleviate that pain and give you a better quality of life. That's next week. Until then, I'm Liz Schatzline. Thanks for joining us. Have a very pleasant evening.